Welcome to the program titled Ethical Violations and How to Avoid Them. My name is Kelsey Lauschen and my contact information is on the slide. This program is a 1-hour continuing education program fulfilling the 1-hour ethics requirement for Ohio social workers, counselors, and marriage and family therapists. We're going to cover the following items in this program. First, we're going to define what the Code of Ethics are according to the NASW. We're going to then define ethical dilemmas and violations, and then describe some of those human elements that can contribute to some of those issues. And then we will highlight certain case examples to bring these things to light. As licensed mental health professionals, we are aware that ethics are a requirement that we have to understand and we have to be able to apply in our day-to-day activities working with patients and clients. So there's a big purpose for why we have these codes of ethics, because our jobs can be very complex and of course they're related to the human condition. So professional ethics are at the core of social work. And for those of you who are practicing social workers, you recognize this, that almost all of your decisions can involve ethical decision making. The profession has an obligation to articulate these basic values, principles, and ethical standards. And we need to be able to communicate that to our patients, clients, and their caregivers, and also to other professionals who may not be in the field of social work. We also have to understand that the code sets forth values, principles, standards that guide our conduct. And these are not strict rules, they are guides. And that sometimes is very challenging for people to remember. It's more of a gray area in some regards. The code is relevant to all social workers and social work students, regardless of their professional functions, the settings in which they work, or the populations that they serve. And we're going to cover all of these items today. There are 6 purposes that the NASW Code of Ethics serves. The first is that it identifies those core values on which social workers' mission is based. So many people get into the field of social work or helping professions because they want to help, and it's understandable. But we have to understand if that person is doing it based solely on their own needs, or can they provide that type of support based on what's best for the patient or the client. 2 is the summarization of these broad ethical principles that reflect the profession's core values and establish those set of specific ethical standards that should be used to guide social work practice. So again, someone enters into the field because they want to help people, but they need to understand that there's these values and standards that have to be used in that practice every day. The third purpose is designed to help social workers identify these relevant considerations when professional obligations conflict or ethical uncertainties arise. And again, a brand new person entering in the field has never been introduced to any of these situations, and that's a really important part of going through their education and training and working with seasoned professionals, is understanding those things. 4 is to provide an ethical standard so the general public can hold the social worker accountable, right? So a counselor or social worker or a therapist needs to be able to perform, but the client, patient, family member, public needs to understand what that person is actually able to perform and what their job can involve. The 5th is to socialize practitioners that are new to the field. As I mentioned, people that are coming into the field, there's a lot of information that they're learning about the practice, and as seasoned professionals, we really need to help and mentor and help them understand ongoing self-care, ongoing education, and other activities that ensure their commitment to those core features of the profession. And then finally, that sixth purpose is to articulate the standards that the social work profession can use to assess whether or not social workers have engaged in unethical conduct. And all you have to do is look at the websites and you will see that the licensure boards list those people who have conducted in violations, right? So in spite of being a licensed professional, those behaviors still do occur. And the NASW has a very formalized process that investigates those ethical complaints filed against its members. And when a social worker subscribes to this code, they're required to cooperate with this. So they need to abide by this disciplinary ruling and any sanctions that occur as a result of it. The code makes specific offerings that we need to consider when we're looking at different values, principles, and standards, because it helps to guide decision making and conduct when ethical issues do arise. It does not provide a set of rules that prescribe how professionals should act in all situations. As indicated earlier in the program, it's not about right and wrong, black and white, this or that. It's about a guidance throughout situations that can occur. And it's important to keep in mind that you've got to look at the context. What's being considered? What's happening between the people who are involved in the conflict? What are the socioeconomic situations occurring? And only then can a decision be made after considering all of these different items. So ethical responsibilities flow from all human relationships, from the personal and the family to the social and the professional. So we're going to look at the 6 core values of the Code of Ethics. This is just a brief overview on this page. So we're looking at service, social justice, dignity and worth, importance of human relationships, integrity, and competence. So from a service standpoint, a professional's commitment to helping people in need and addressing social problems. From a social justice situation is the pursuit of social change and fairness, particularly for those vulnerable and oppressed populations, which is such a common scenario for social workers and counselors to address and work with. Dignity and worth, so respecting the inherent value and uniqueness of each individual, because if a social worker, counselor, or licensed professional is working with somebody who's coming from a completely different upbringing, lifestyle of their own, they need to always keep in mind, where is this person coming from, right? Meeting people where they're at. The importance of human relationships, so valuing and strengthening relationships to support change in spite of what might work best for me in my life as a professional. That doesn't necessarily mean that that's going to work the best for my client or my patient, so we have to be mindful of that. Integrity, acting with honesty and responsibility in all professional matters, and remembering who we are at the end of the day, right? When we walk out of work and we clock out, or whatever the case may be, we still know who we are professionally, and we have to act with those things in mind. And then competence, so practicing within one's area of expertise and continuing to develop professional skills and knowledge, which is continuing education, right? And also other developmental opportunities that may occur at work, maybe moving into new positions, maybe moving into manager positions or supervisory roles. So these are the 6 core values that we will explore further. As I indicated on the previous slide, we're going to do a little bit of a deeper dive into all of these areas. Let's start with social justice. and we're looking at the ethical principle of social workers challenging social injustice. So social workers pursue social change, particularly with and on behalf of vulnerable and oppressed individuals and groups of people. And if you were to ask someone, what do you think of when you think of a social worker? I think that is one of the most common definitions and descriptions of what a social worker does. However, social workers can work in every different setting with all different types of individuals. However, the focus and the development of the field of social work certainly stemmed from this. So social workers' social change efforts are primarily focused on issues of poverty, unemployment, discriminations, and other forms of social injustice. But what's important for social workers to keep in mind is that their own opinions can't delve into what is happening among those that they are serving. And I think that's where some people have challenges, is keeping my own opinions to myself and just looking at what is the best thing for the individual, and being able to be present and available for a person regardless of your own opinions of what would happen in your own life. So these activities seek to promote sensitivity to and knowledge about oppression, cultural and ethnic diversity, which is such an ongoing and important element in the social worker industry. And social workers strive to ensure access to needed information, right? So we are advocates. We are working to make sure that our patients and our clients can get the information that they need and help to navigate through that. It's such a complex world that we live in, and the services available, but people just don't know how to navigate through this. Many times, professionally speaking, I've had difficult time navigating, and I think to myself, wow, how can my patients and my clients navigate through this when I can't, and I'm trained to do this? So it's really about equality of opportunity and meaningful participation in decision-making for all people, not just a particular type or background or culture or whatever the case may be. It's for everyone involved. So dignity and worth of the person, and that ethical principle is that social workers respect the inherent dignity and worth of the person. And again, dependent upon the population that you're serving, the area that you are working in healthcare and school systems, whatever the case may be, you're going to encounter people that are very different than yourself. And social workers really need to learn how to treat each person in a caring and respectful manner in spite of our differences. So we have to be mindful of these differences, and both from a cultural and an ethnic diversity as well. And social workers need to promote clients' social responsibility for self-determination. And I think this is an area where we can sometimes be a little bit too helpful, right? Where it turns into enabling, when we need to be encouraging the person to learn how to advocate for themselves and how to navigate along, instead of getting the answers for them, helping them to get the answers. So social workers seek to enhance clients' capacity and opportunity to change and to address their own needs, right? So as a goal, right, when we're working with patients and clients, that's really what we're looking to achieve, that paragraph. So social workers are very cognizant of their dual responsibility to clients and to the broader society, right, because we're attending to both. They seek to resolve conflicts between clients' interests and the broader society's interest in socially responsible and consistent ways. And we have to keep in mind the values, these ethical principles and ethical standards of the profession ongoing, no matter what we are doing on a day-to-day basis. These are the underpinnings of everything that will help us to guide those decisions alongside of our clients and our patients. The next ethical principle is integrity, and social workers behave in a trustworthy manner. So when we think about those people who we are supporting and the situations that they are encountering in their lives, they're very vulnerable, right? They need a lot of help and a lot of support, and in order to work with someone, we obviously have to establish trust. And people come from all different walks of life with a lot of different situations that they've encountered throughout their lives, many traumas and really negative experiences. So it's really important that we work to develop that trustworthiness with our individuals that we are supporting. And social workers are continually aware of the profession's missions, values, ethical principles, ethical standards, and practice in a manner that's consistent with them. So they don't change based on the individual they're working with. Decisions may change, but we're continuing to present ourselves in the same way. So social workers need to take measures to care for themselves professionally and personally. And I think self-care is one of those areas that is lacking often, because in a social worker capacity, we're taking care of people all day long, and then we don't leave a lot of time for ourselves. And then we're turning around and talking to our clients and patients about taking care of themselves, and we're not doing the same thing. So it's important that we're mirroring back to them what that looks like. And social workers act honestly and responsibly and promote these ethical practices on the part of the organizations with which they are affiliated. So if you are working in an environment that doesn't believe in professional self-care, and they're driving you to, work these excessive amount of hours and not taking time for yourself, then we're probably not going to be very effective for those that we are serving. So again, it's one of those considerations from an organizational standpoint, and also for us professionally to ask ourselves, what's the best thing for me too? If I am a healthy professional, I am going to be healthy for my clients and my patients. So it's just another area of consideration and discussion that I think oftentimes comes up in our profession, no matter what helping profession we may be in. So the next principle is of competence, and social workers practice within their areas of competence and develop and enhance their professional expertise. And this is an area of concern for a lot of different industries, right? That a person hangs a shingle outside their office and they have 15 different specialties. And I always think to myself, that is the last person that I'm going to go see for my issue. I want to see someone who is specialized or trained, educated, knowledgeable in one of these areas, right? So I'm not going to suggest that someone go work with somebody who is in pediatrics if they're looking for geriatric support, right? So we have to take ownership and responsibility for how we are presenting ourselves. You might have an area of interest that you're in, but that doesn't mean that you're fully competent or an expert in those areas. So just be very aware of what you are sharing with those patients, clients, loved ones, and other colleagues when somebody is talking to you about certain areas. So social workers need to continually strive to increase their knowledge and skills and apply them in their practice. So whatever your practice may be, those skills, just like in anything else that we do, need to continually be refined and worked on. And we continue to learn more and more and more, regardless of what situation or industry that you're in. It's our responsibility to continue to be the most knowledgeable that we can be. And we turn to other people who have more knowledge than we do. And we go back to school and we continue to get our continuing education, whatever it takes. So social workers should aspire to contribute to the knowledge base of the profession. And I think of, all the years that many of us have been in the field, that if I was still applying the same principles from 25 years ago to my practice right now, I probably wouldn't be in business, because we've learned so much more about trauma, about addiction, about geriatrics, all these different areas, right? And so we need to continue to hone those skills and be the best that we can be for those people that we serve. The ethical principle of service is that social workers' primary goal is to help people in need and to address social problems. So again, that would be a good definition of social work. But social workers need to elevate their service to others above that self-interest. And again, if you're feeling kind of burned out and if you're overworking, that's very, very difficult to do. So self-care is always a part of this. So social workers draw on their knowledge, values, and skills to help people in need and to address these social problems when possible. And they are encouraged to volunteer some portion of their professional skills with no expectation of significant financial return, so some pro bono service. And I think that for almost every industry, right? Professionals, as we continue to evolve and develop personally and professionally, that we want to give back. It doesn't mean that we do so that it's, we're overworking and we're over volunteering, but it's looking for those opportunities to give back whenever we can. The ethical principle of the importance of human relationships is really recognized by social workers as a central part of what is meaningful to patients and clients, and helping them to bridge those gaps and develop meaningful, healthy relationships. Oftentimes, we're introduced to our patients and clients because of unhealthy relationships. And people have been through a lot of challenges, they've lost trust, they don't know how to develop meaningful or healthy relationships because of their upbringing, because of their family systems. So it's really important that social workers can help to define and support people to develop those relationships that are healthy. So social workers understand that relationships between and among people are important. And in spite of some people saying, you know what, I just don't trust anybody, that person's hurt me, I've come from this terrible situation, I can't possibly develop those relationships. So by being that social worker they can trust and they can turn to, that is one of the areas that individuals can learn how to develop human relationships that are healthy. So social workers engage people as partners in the helping process, and they seek to strengthen relationships among people in a really purposeful way. And that is to promote, restore, maintain, enhance lots of different elements that go into developing relationships, and those relationships can be individuals, families, friends, loved ones, organizations, lots of social groups, work environments, right? So we can't get through life without having a relationship in certain different capacities. Maybe you are working with somebody who's very a recluse and very introverted, but they still have relationships that they can work to achieve and develop. And maybe some of those who are very extroverted and have a hundred different friendships, but they're not very deep and meaningful. And there's an opportunity there as well. So development of human relationships is such an important element in the social work practice. There are several code of ethical standards. The social worker's ethical responsibilities to the clients come first, and that shows the commitment to clients, like keeping appointments on time, making sure that you don't run over into somebody else's time, making sure that the client understands what is going to happen in a session, making sure that the client understands what the relationship is with the social worker and what the social worker's role is. Having informed consent, the client understanding that there may be the need to increase a level of care, increase medical care, understanding that there is a relationship between medical professionals and that sometimes they need to be referred to another level of care depending upon what their medical situation is. The ethical responsibilities regarding cultural competence and a social worker understanding that with different cultures comes different types of behaviors and beliefs and values. Also privacy and confidentiality, so that they understand when they come into practice or working with a social worker or counselor that their confidentiality is always upheld, and understanding that the only time that a professional will make a report is based on harm to self or others. And also understanding that we're not going to be talking about their case and about them to other professionals outside of maybe a treatment setting if it is a part of a team environment. Also avoiding conflicts of interest. So clients need to understand that we are not in a position to be friends with them. And if I see you in a grocery store, I'm not going to walk up to you and say, hey, remember what we talked about in treatment the other day?
or that they are going to reach out to you on Facebook and try to connect with you and establish a relationship through social media. So these are all different responsibilities that we need to explain to clients when they start working with us. The social worker's ethical responsibilities to colleagues. So understanding that there is collaboration and respect with those relationships, and many times we need to make referrals to other colleagues and discuss clients' situations in a confidential manner without disclosing the name of the client, but detailing the issues at hand. And also with the concern of unethical conduct, that a social worker or counselor may see someone else, another social worker or counselor, being unethical in their behaviors, and understanding how to go about making a formal complaint about that person. The social worker's ethical responsibilities in practice settings. So what is supervision? Who is the supervisor? Are they qualified? Understanding the process of consultation. If there is a concern with your client and your patient, what are the steps necessary to seek consultation? And maybe performance evaluation for myself, the social worker, the clinician, understanding that they go through maybe an annual review or a biannual review, whatever the responsibilities are stated in that practice. Also, the counselor, supervisors, or counselor or social workers understanding of the client records and the completion of notes in a timely period, understanding that there are very specific billing practices and that they are held accountable for issues that may occur in those practices, and that they understand the process of billing, and that it's again a timely matter, so that those records need to be in place so that billing practices can occur. Social workers' ethical responsibilities as professionals. So maintaining integrity and making sure that we are continuing to expand our knowledge and pursue continuing education opportunities, avoiding dishonesty, fraud, or deception to other coworkers, clients, patients, family members, caregivers, other professionals in the medical practice or wherever the social worker may be practicing. Social workers' ethical responsibilities to the social work profession itself, and promoting the high standards contributing to knowledge and advocacy of the profession. And it's important that the social workers establish with with other professions outside of the profession too, what a social worker's role actually is. Many times people make the assumptions that social workers are there to fix and take care of all of these issues for individuals without understanding that they truly are in a supportive role and in an advocacy role. And social workers' ethical responsibilities to the broader society. And so we need to be able to promote social welfare and public participation. There may be opportunities to engage in social and political action, but also understanding that we need to keep our personal out of our professional lives and have some continuity in both of those areas. So lots of different considerations when we're talking about the ethical responsibilities that a social worker has. So just a review of the ethical standards. The following standards are relevant to the professional activities of all social workers. As we just stated, these standards concern their ethical responsibilities to clients, ethical responsibilities to colleagues, ethical responsibilities in practice settings, ethical responsibilities as professionals, social workers' ethical responsibilities to the social work profession, and ethical responsibilities to the broader society. So some of the standards that we discussed are enforceable guidelines for professional conduct, and some are truly aspirational. And that goes back to what we've been stating about the rules versus guidelines, etc. So the extent to which each standard is enforceable is also a matter of professional judgment, and it needs to be exercised by those who are responsible for reviewing the alleged violations of ethical standards. So again, people who have been in the field for an extensive period of time, who've held supervisory roles, who are familiar with ethical guidelines, are typically those who are going to be looking at these types of behaviors and making those decisions. So when we talk about ethical values, it's important to understand the difference between values and standards. Values define why we do what we do and what we believe in. And they are who we'd like to be consistently and how we go about achieving those things that we are looking to achieve. Standards, on the other hand, define how we go about doing those things. So in a social worker ethical value, these are foundational moral beliefs that shape ethical decision making and guide professional conduct in social work. So these values reflect what is considered morally important in the profession. And I like the idea of using a moral compass, but again, we have to remember that our own personal compass can be very different than when we are working in a setting, a professional setting, because we're looking at the compass of really the organization as well. So a compass for navigating complex human situations with care, fairness, and accountability. And all of those items are influenced by our own personal experiences that we've had. So it's important that we separate, again, the personal and our own experiences from the professional compass that we need to have. So they are broader than rules and standards and more fundamental than principles. So they really define what matters ethically. It's not the actual behavior, but it's about what truly matters. So I've provided a personal scenario before we start looking at some of the professional scenarios that may occur. And this is something that happens so frequently, and people really struggle with this on a personal level because it raises a lot of different examples of maybe what we went through growing up or what we've watched other family members go through, etc. So let's just look at this personal situation. So your child asks you if Santa Claus is real. And again, dependent upon culture, it could be something else. It doesn't necessarily need to be Santa Claus, but it's a fictitious person or being, if you will. And so what do you do? And it does create a personal dilemma for a lot of people. So here's some examples, and we look at these and we say, okay, we have different ideas on how to address this. So you tell them the truth, and you also tell them about all the other ones that aren't true either, right? And that's a very common scenario. I've heard this many times in my personal life and also in my professional life, working with other people and maybe working with a client or a patient that's going through this. In fact, tell them that the most of what they know has been a lie, and further suggest that they're going to discover more lies as they get older. So that could be an option, right? And again, when we're looking at these, we're not looking at right and wrong. We're looking at based on the situation, based on the person, based on culture, based on family dynamics. There's so many different variables to consider for why a person decides which to pursue. So the second one is you ask your children if they really want to know the answer or if they'd like to keep receiving presents from the magic people, right? So from whatever that is, if it's not Santa Claus, maybe something else, right? So it's another option, right? And then a third option would be assure them that Santa Claus is responsible for bringing their gifts. They will find out on their own that he is fictitious. So this is very similar to the dilemmas that we are faced with as a social worker as well, that we have options. We have multiple options based on a situation. And personally, when we look at these, we say, wow, it is confusing, right? There's not one of these that says absolutely we must do this. But I think it's great when we can look at our own personal situations and understand that these are situations that our patients and clients face. And of course, we're going to talk about some other situations that our patients and clients are more likely to experience in something like this.
So it's really important for social workers and counselors to understand the difference between an ethical violation and an ethical dilemma. And what we just looked at in the previous screen was certainly an example of a personal dilemma that many of us could experience or have gone through, but we're going to need to understand the difference because sometimes these terms are used interchangeably and they do not mean the same thing. So let's take a look at this. So the difference between an ethical violation and an ethical dilemma lies in the clarity of wrongdoing and the complexity of decision making. So what exactly does that mean? So the violation is when a clear standard or a rule that's outlined in the NASW Code of Ethics is broken. So it's very typically a black and white situation. Clear as a bell, having a significant relationship with a client, right? That's very clear to us. And it's the most common violation that occurs. So you can look online and find out that there are a number of professionals that still seem to participate in that, in spite of knowing that it's a violation. Maybe we hire a client to come to our home and perform some kind of painting or yard work or something like that. Obviously a violation. Maybe we don't bill correctly because we care about a client or we have concerns about or we're enabling a client, right? So those violations are very, very clear. But a dilemma, not so clear. And I think we just saw that in the prior slide. We were talking about one of these situations that many of us can relate to. We've gone through it before. So the dilemma is when a social worker or counselor is faced with two or more competing ethical principles. And there is no clear right answer. And it involves this complex decision-making model. And each option has to be looked at and says, well, if we do this, then this might happen. Or if we do this, then this might happen. And it requires going through this model, which we are going to review and go through step by step so that everybody understands how to use the model and how to reach the outcome that is most appropriate for the client, right? It's not a right or wrong, so it's important that we always keep that in mind. So let's look again at an ethical violation example, and this is something that I just mentioned on the previous slide, but the scenario is that a social worker or counselor begins a romantic relationship with a current client. And again, the most common violation that occurs in our practice, but it's important for us to remember that it is a violation. So the explanation, this is a direct violation of the NASW Code of Ethics, which clearly prohibits dual or romantic relationships with clients due to the risk of exploitation and harm. So there's no ambiguity. This is considered unethical and a breach of professional boundaries. And again, this is very clear, but if we look at the Code of Ethics, there's also a timestamp that is defined within that Code of Ethics that says after a certain period of years that a person could actually have that relationship. What I have always learned as a counselor is that this person could always return to be my client. So I want to insert that here is that for me, a client is always a client. Whether they are currently in practice with me or not, this is not a person that I will ever enter into a relationship with. So I just always want to insert that here because I think that there are times where there is a natural attraction between professionals and maybe that professional continues to work with this individual and they leave their practice and the professional starts to think, well, in a matter of years, so many years, I might be able to enter into a relationship with this person. So I just always say, take that off the table, right? That should not be in our repertoire, our professional repertoire. So let's look at an example of a dilemma, not similar to the one that we had looked at earlier in the program, but something related to maybe what a client or a patient might be presenting to us in our practice. So here's the scenario. A teenager client confides in a school social worker that they are pregnant, but begs the social worker not to tell their parents. However, the school district policy requires parental notification for medical issues. So quite the dilemma for the social worker. So let's look at some of the challenges here. So the explanation is the social worker faces a conflict between respecting the client's confidentiality and autonomy, which is a core value of the profession, and obeying legal or institutional policy that may require disclosure. So there's no clear-cut answer, and the social worker must weigh the risks, values, and consult ethics guidelines or supervision. So always turn to your supervisor, right? And there may be an opportunity to even discuss as a team, depending upon where this person, the school setting that they're in. But again, this is one of those perfect dilemmas of what's the best thing for the client. It's not so much about what's the best thing for the school in this situation, which is a consideration, but comes down to what is the most appropriate for the client at hand. As I mentioned, using the ethical decision-making model can be really helpful when we're faced with these dilemmas. And this is certainly something I'm sure many of you have used, but I think it's a really good review. So let's just look at, again, a couple of these situations that we have looked at already in the program. We could see how to apply them to this situation. So identify what is the ethical issue or issues, including the social work values and duties that conflict. And you can look at that situation with the student and understanding what the ethical issues are. We've got the ethical issue related to the student and the medical situation related to reporting in the school setting. And then identifying the individuals, groups, or organizations that are likely to be affected by the ethical decisions. So for this individual, we've got obviously the individual themselves, their family, the teacher, the school system, any type of authority that overrides that institution. So there are a number of different individuals and groups that could be affected by that. 3 is tentatively identify all of the possible courses of action and the participants involved in each, along with the possible benefits and risks for each one. And again, this is where I think a comprehensive look at the situation, certainly for the one that we just looked at, there's so many different courses of action that could occur and the benefits and risks for each one of these. 4 is thoroughly examine the reasons in favor of and opposed to each possible course of action. So considering the relevant theories, principles, and guidelines, the codes of ethics and the legal principles, the social work practice theory and principles, and the personal values, which include religious, cultural, ethnic values, and political ideology. So again, with that situation in mind that we just looked at, there are a number of different considerations that need to be looked at, and we could see some of the more obvious ones that stand out, but then when you start to pull apart the layers, you understand the complexity of making that decision. 5 is reflect on who to consult, and this could include colleagues and appropriate experts, such as agency staff, supervisors, administrators, attorneys, ethics scholars, and ethics committees. So again, dependent upon your practice mode, your practice organization, there could be a number of different professionals involved with this process. 6 is to decide and document your decision and the decision-making process that occurred to reach that decision. And I always say document everything. Document, document, document. You can never document too much. And then 7 is considered how to evaluate, monitor, and document the scenario going forward. So after the decision is made for this person that we just looked at, we need to evaluate, monitor, and document the scenario moving forward. Does this person continue in the school system? What are the relationships as a result of this? How are they impacted? Right? There's a lot of different scenarios involved with this. Do we bring in an outside counsel or counselor or a professional group or organization that can support the individual? So as you can see, this process, as I'm sure all of you are familiar with, if you're a practicing social worker counselor, that you know that it's necessary to go through this process. I think there are times that we forget to go through this whole process step by step by step, that we just kind of make assumptions sometimes. So it's really important to use this model. Maybe you have this laid out in front of you, and you just make sure that you're going through each step as you make your decisions. As helping professionals, social workers and counselors, we need to always keep in mind about the human condition. And I think that came about when we were talking about violations and when we're having concerns about relationships with clients and patients, etc., where we start to see these things can occur. And unfortunately, oftentimes professionals get into the helping profession and they haven't done their own work and are not necessarily knowledgeable and following along with some of these guidelines. So let's just take a look at some of the human condition and the contributing factors. Again, I'm sure many of you have probably considered this and looked at this very early on in the profession, but it's a good reminder. So who enters into a helping profession, right? Are we the walking wounded? Are we people who are trying to work through our own pain and our own healing process by helping other people? What is it? What's the draw for people that want to be helpers, professional helpers? What are the potential characteristics of somebody? And it's not unusual to have a person that enters into a helping profession who also came from a situation that may have been unhealthy, right? So maybe they have a challenge with boundaries. Maybe they overshare. Maybe they undershare, right? Maybe they're very stoic and not warm and empathetic, right? So there could be a whole variety of characteristics to consider. So define unwell, untreated, and possibly unfit professionals. Does this person have a substance abuse disorder, right? This is in one of those areas that sometimes we don't find out until much later. Are they dealing with their own abuse, neglect issues in their own home, with their own family of origin, with their own spouse, their children? There are a lot of different contributing factors that we can't ask on an interview or during the time of employment. As I mentioned, poor boundaries. Are they inviting a person to participate in ways that are not most appropriate for the client or the patient? Are they sharing? Are they oversharing? Are they bringing in gifts? Or are they accepting gifts? A lot of these different situations that professionals need to be very mindful of. Are they unhappy in their personal relationships, right? And how does that show up as a professional? Are they projecting? Are they imagining the same situation happening with their client because it's happening in their own personal life? Are they financially challenged? And that certainly can impact a professional setting. Are they able to get to work on time? Are they dealing with their own stressors, and that's showing up in their practice? Are they burned out? Right? And certainly we need to be practicing a lot of self-care. And if you're working within an organization that does not support self-care and professionals are providing services while they're burned out, that service certainly is not going to be conducive for the client or those that they are serving. So there's a lot of different human conditions and contributing factors that we need to be mindful of in ourselves. And also if we are supervisors or managers or colleagues, that we are bringing these to the attention of the person, and if necessary, to their supervisors or managers. And maybe the person's medically compromised, right? Maybe they have some of their own issues that are requiring them to seek medical care, and that could be complicating their ability to be an effective therapist or social worker. So let's take a look at some of these situations that arise. And I know some of these may be bring about a little bit of humor for people, but I will tell you I've seen a lot of these over the years, and I want to just remind everyone of the importance of maintaining our professional boundaries and also to be mindful of these ethical violations and dilemmas that may present themselves in our practice. So we have the super handy client who is unemployed, and you know what? You've got that room that really needs repairing at your house. And you're thinking to yourself, wow, I'd really like to give this person a chance, an opportunity. They really can do very well, and I want to be that person that's really supportive of them, right? So the social worker's reasoning is, we can understand that. They're big-hearted. They really want to help this person get back on their feet. It's also going to save the social worker a lot of money. So the impacts to the client is what we always need to be mindful of. Is changing the relationship dynamics with the social worker. That social worker doesn't become the social worker anymore. Becomes their friend, becomes their employer. All of the relationship dynamics change. Enabling, which is reducing that client's self-determination. And this is such a common issue with so many people, not just professionals, is that we think we're helping, but what we end up doing is enabling. And we're making things easier for the person instead of supporting the person in making some of those decisions on their own and finding that work for themselves. So another one, the attractive client. They are exactly your type. So depending upon where the professional's at in their life, right? Maybe they're feeling very vulnerable. Maybe they just had a recent breakup of their own. Maybe they are thinking to themselves, wow, this is a miracle. I'm in practice and the perfect person just walks into my office, right? So this client has started to share thoughts and feelings that totally resonate with you. And they've made a lot of progress, and you're planning to discontinue meeting with them. So this reminds us of what we talked about early in the program. And you plan to let them know you can meet them for coffee after they leave your services. So the social worker has fantasized that something romantic will happen with the client after they discontinue the services. Obviously, there are a lot of impacts to the client. Social worker isn't necessarily thinking about those. So it's that dual relationship, right? Taking advantage of the vulnerability that involved in the session. And I have never known of any of these types of relationships to be successful. So it's important that we always go back to our values, our standards. And the client learns to distrust the therapeutic process, which is so important because they need ongoing support. They need ongoing care. And certainly if they are in a relationship with their client, with their social worker or their counselor, that is going to eliminate the opportunity for them to continue on in seeking another relationship or another professional relationship, and they're going to be under the assumption that that's what happens with professionals. This is the most common violation, as I mentioned earlier. And again, it goes back to where's the professional at, right? What's going on with the professional who is considering these things? So here's one case study just to consider and for yourselves, and maybe you're looking at some case studies for your practice or staff meetings, etc. A social worker working in private practice is contacted by an individual who lives over 30 miles from the office. They are looking to receive counseling. The social worker offers telehealth services as part of their practice and explains the social work modalities they practice from, as well as the technologies they use to offer their services. And we certainly have seen a lot of this integration into our field over the last several years. The social worker reviews 2 consent forms with the client, one which discusses the services offered and the other which is specific to telehealth service provision. The client is made fully aware of the risks and benefits associated with all aspects of the service and is interested in proceeding with the services. However, the client cannot meet the social worker in person and doesn't have access to a printer. How can the social worker receive proof of consent from the client? So again, one of these dilemmas, right? This is not a violation per se, but it raises questions about what is it that the social worker then can do to support the client to help make this process more achievable for the client. So according to the NASW, this is the solution for this situation. So social worker is unable to receive official written consent from a client. The NASW recommends accepting a consent form that includes the client's signature, such as like a PDF fillable form. It is recognized there are times when clients are unable to provide an electronic signature. They don't have access to a computer, and we can't make those assumptions. And certainly they may not have access on their phones. And in these cases, social workers can accept a client's verbal consent to receive services and receive written consent at a later date. So the social worker must be sure to document the details. Again, there's our documentation surrounding the consent received, including the reasons why the social worker was unable to obtain the client's written consent in the file. So as a best practice, when possible, the client should provide written consent at earliest opportunity, and services may proceed based on verbal consent. So again, one of these really good, sound case studies that many of us face, and certainly this is a great discussion point for a professional setting with our other colleagues, our staff, to discuss these types of situations so when they do occur, we're all on the same page. So here's another scenario that could occur. So a social worker providing counseling to an older adult client. Many of you are in that situation. The client discloses they sometimes forget to take their heart medication and occasionally take extra doses when they feel unwell, which we know certainly is dangerous. They refuse to allow you to inform their primary care provider and insist you keep it confidential. What's the most ethical course of action? So again, we've got these 4 different scenarios, solutions, options. A is respect the client's wishes, keep the information confidential, and continue to monitor their health behavior in sessions. Certainly an option. B, immediately contact the client's family to inform them of the situation so they can intervene. Well, if we don't have a release of information, an ability to do so, is that the most appropriate thing? C, discuss the risks of non-adherence with the client, explain the limits of confidentiality, and discuss the client's consent to involve their provider. If the client's life is in imminent danger, breach confidentiality is required. So that feels very comfortable, and it covers confidentiality, it covers protection, and I think that would probably be the most advisable. But again, I'm not the clinician, but it's a consideration. So in D, end the therapeutic relationship due to the client's refusal to follow medical advice and breach confidentiality. Another option, right? But out of these 4, it appears that C is probably the most suggested option for this client. But as we can see, here's the dilemma, right? There's several different ideas and options available dependent upon the background of this person. There's a lot of things that we don't know about the situation going into this case. Our final scenario is a counselor at a community senior center, which many of you probably can relate to. A former client worked with 6 months ago invites you to their 80th birthday celebration, which will also be attended by several of your current clients. The former client says it would mean a lot to them if you just came as a friend. What's the most ethical choice? Well, you can't be the friend, which we've talked about before, but again, we've looked at all these different options. So A is decline the invitation, explaining that attending could create a dual relationship and blur these boundaries with current clients. B, accept the invitation since the client is no longer receiving services and it's purely a social event. But we remember that it's important that they could always be a client. C, attend the party but avoid interacting with current clients while you're there. And D, ask a colleague to accompany you. There's a witness making it acceptable to attend. And again, these are all options, but when we look at the whole scenario and we look through our decision-making model, A is probably the most likely choice for this. Hopefully, through today's program, this is brought to light for you some of these dilemmas, some of the violations, and these things that we need to do professionally, and also reminding us to use our decision-making model. And good luck as you move ahead back into your practices. Thank you.